Are you confused about what vitamins and supplements you should take? There are so many that claim better hair, smarter brain, and healthier heart. You want to do the right thing, so you just pull out your piggy bank and buy it all. But wait a minute. What do you really need? Today, let's look at what vitamins and supplements doctors take for their own health.
Healthy isn't just what you do, it's who you become. I'm Dr. Vickie, and this is Healthy Looks Great on You, a lifestyle medicine podcast to help you reclaim your energy, your focus, and your well-being. Life tested, doctor approved.
I'm old enough to remember advising all women in my OBGYN practice to take a calcium and vitamin D supplement to keep their bones strong. And if you've ever listened all the way to the end of one of my podcast episodes, I always say, new research may develop and recommendations may change. Yeah, that happened. After decades of making a recommendation for all women, studies showed that calcium and vitamin D supplements might not be so great for everyone. They can cause constipation and lead to kidney stones, but my whoa, hold up moment came when high-dose calcium supplements were linked to increased heart disease and stroke. Now, before you get totally confused, remember, we're talking about supplements. Your body absolutely needs calcium and vitamin D along with other vitamins and minerals for your bones and overall health. But today I'm only talking about what you get in a pill. You know, it's probably time to go to many medical schools so you can learn what your classmates take for their health. And let's start with the basics. Vitamins are micronutrients that your body needs but can't always make on its own, unless you count vitamin D, which is made in your skin as a response to sunshine, or vitamin B3, which your liver can make from protein, and vitamin K, sort of. You can get the vitamins your body needs from food if you eat a well-balanced diet, mostly. On the other hand, supplements are a manufactured product. You know that means they aren't natural, right? But 60 to 75% of people in the United States take supplements at a cost of $60 billion a year in hopes that they can live longer, healthier lives. And I'm quoting, according to the FDA website, dietary supplements can help improve health, but can also have risk. It says, and I quote, "Get the facts on supplements and how the FDA regulates them to help keep you safe." Facts. Yes, let's get the facts. Fact number one, supplements do not have to be proven to work. This is very different from pharmaceutical drugs, which must undergo extensive testing to prove that the drug actually does what they claim it does. Fact number two, supplements are regulated by the FDA, but not as drugs. They're regulated as food. And so the stance of the FDA is that they are not to replace a balanced diet or medical treatments. Fact number three, the manufacturer is the one who is responsible to make sure that the label matches what's actually in the bottle. And fact number four is there can be wide fluctuations in the potency of supplements. For this reason, when taking a supplement, you want to make sure that it's been independently verified by a third party. Now, that still doesn't necessarily mean that it does what it claims, just that it contains what it claims. But nevertheless, look for legitimate organizations like the NSF International or USP, which stands for United States Pharmacopoeia. So let's just say you pass the preliminary pharmacology class. Oh wait, never mind, it needs to be a nutrition class, but not really. Anyway, you want to know what supplements your doctor takes for themselves or recommends for you. Well, that depends on what you're trying to accomplish. And recently a friend of mine was taking something and I said, "What's it supposed to do?" And she said, "I don't know. I just thought I should take it." Now listen, that's not how this is supposed to work. When doctors take supplements, they usually do it to correct a deficiency. not to prevent or treat a specific disease, although there are circumstances where that is indicated. If you have anemia from iron deficiency, then you need to be taking an iron supplement. But today, we're going to start with vitamin D because vitamin D deficiencies are not uncommon. I have a whole episode about the new recommendations regarding vitamin D supplementation. But here's the cheat code. You need it if you're deficient, and the dose should be tailored to your individual needs. One size does not fit all. And I got the idea for this episode when I visited a friend's house who is a doctor. And there was a place in the kitchen with a few bottles of supplements on a little tray. Now, I didn't inventory what was there, but I did notice a multivitamin, vitamin D, and creatine. Creatine is the new kid on the block for doctors, but not bodybuilders. And recently I did an episode on creatine and convinced myself to take it, even though the evidence is still preliminary. And I don't take many supplements, but I am trained in lifestyle medicine, which advocates a plant-forward diet. And there is no vitamin B12 in plants. So if you're following a whole food, plant-based diet, and especially if you're vegetarian, which is a different thing, you need to take a vitamin B12 supplement. Now, I'll be honest. I eat some meat, not a lot, but probably plenty to keep me from being deficient in vitamin B12. Nevertheless, I decided I might as well take a multivitamin if I needed a B complex. And I remember when I was a little girl, my mom gave me a Flintstones vitamin every day. And I got to decide if I wanted Pebbles or Bam Bam or Fred or Wilma. But as I got older, I didn't take vitamins. I bought some and I had trouble remembering. I keep them in the bathroom where I don't have easy access to water. Plus, they upset my stomach if I take them first thing in the morning on an empty stomach. So I had a great idea. I got gummies. But then I didn't follow my own advice. I didn't read the label and realized they had sugar in them. Ugh. I was good at remembering, and I think they reminded me of those Flintstones. But if you know me, you know I say, I'm not really a supplement person, but I am an evidence-based medical doctor. So let's look at the evidence. Almost 500,000 people were evaluated across multiple studies, and it turns out that multivitamins did not lower the risk of dying. Now look, we're all going to die, so maybe that was a setup, but not really. When we say the risk of dying, what we really mean is the risk of dying prematurely, sooner than expected. The goal isn't to live forever, it's to live to a ripe old age with your health intact. But let me tell you about the report from Harvard Health in April that kind of made me rethink whether or not I should make the effort to take a multivitamin. This was a report about the Cosmos study. A previous study on 14,000 male doctors who took either a placebo or a multivitamin had just showed so-so results. Maybe a tad lower rates of cancer and cataracts, but it didn't really move the needle on heart disease or brain health. Now, note, this was a boys-only study. So the Cosmos study included women in the 20,000 people studied. What a concept. These were older adults who either took a multivitamin and cocoa, or a placebo and cocoa, or just 2 placebos. After 3 years, they found the same results for heart disease. But when they called about 2,000 of them and did a little cognitive test, the ones who took the multivitamin performed better, to the tune of the equivalent of about 3 years better in cognitive health. Now, to tell the whole story, there were 2 other sub-studies, and they did not confirm that benefit. And the average person eating a well-balanced diet probably does not need to take a multivitamin. But who eats perfectly? And I don't think it will set you back much financially, and it's not really harmful unless you make the mistake I did and accidentally add a few grams of sugar to your morning routine. But to be clear, the U.S. Preventative Services Task Force takes the official stance that there is not enough evidence to recommend either for or against multivitamins for preventing cardiovascular disease or cancer. So yes, no, maybe is the answer. Another common supplement doctors take or recommend is magnesium, and there is some evidence that it helps with migraine headaches. And your body needs this mineral for muscle function, and it has shown some benefits for sleep in people who are deficient. And this is the key message. Supplements shouldn't be random, but rather used to address dietary deficiencies. Getting your vitamins and minerals and nutrients from food is always better, and there are plenty of foods that are rich in magnesium. What about fish oil or omega-3 fatty acids? Believe it or not, this one is also debatable. Research seems to show that it really does not prevent heart disease. Now, it might benefit people who have high triglycerides or rheumatoid arthritis, but you can get it from food and skip the dead fish breath. So there's that. But here's the deal. The studies showing a benefit from omega-3 fatty acids were in people eating fish, not taking supplements. Omega-3 fatty acids are important for overall health and for fetal brain development, especially DHA. So they're often found in prenatal vitamins. And speaking of prenatal vitamins, I want you to hear this message loud and clear. Prenatal vitamins contain folic acid, which significantly helps prevent neural tube defects like spina bifida. But the neural tube closes about 26 days after conception, which is really early in pregnancy. In fact, some women might not even realize they're pregnant yet. So if you're of childbearing age and you're not using reliable contraception, you should take folic acid. And it's already in your prenatal vitamin. If you have the MTHFR gene, your doctor might recommend methylfolate instead. Now, for those of us who are not of childbearing age, this next one is going to sound familiar, especially if you're over the age of 50 and you've had your colonoscopy. You probably got a little handout from your doctor recommending more fiber. And you know I love fiber, which is only found in plants. Recently, I did a 7-day fiber challenge, and it was awesome. Of course, in the challenge, I guided people to get more fiber in their diet from high fiber foods. And it was so much fun, I'm already thinking about doing it again. And here's the thing, if you're not on my email list, you might not have any idea when that's going to happen. Because my email list is the one place I announce this stuff first. So go to healthylooksgreatonyou.com and get on the list so you don't miss it. That is healthylooksgreatonyou.com. But you can take a fiber supplement, and GI doctors in particular do recommend it. Specifically, Metamucil contains psyllium husk, and there is research that shows that that can help with constipation, lowering cholesterol, and balancing blood sugar. So this is a definite thumbs up if you can't get it in your diet, which is always better. Did I already say that? I still don't consider myself a supplement person. I have a disease that can actually get worse by taking magnesium, so I understand that there are individual nuances, and supplements can actually be detrimental to your health. And as a caution, I want to mention that you should avoid high doses of vitamin A and vitamin E. And maybe we'll do an episode on vitamin toxicities. For your reference, I've included links to the studies I mentioned, as well as the podcast episodes for expanded information. But as I said before, I convinced myself to give creatine a try, and I'm trying to remember to take my B vitamins. Not the Flintstone one or the one with sugar, though. It's hard to know what to do to stay healthy, and many people in this space are trying to scare you and sell you a supplement, even if there's not clear evidence it works. So if you want more of this, medical information, straight talk, no hype, just get on my email list at healthylooksgreatonyou.com. Each week I share the podcast episode and one simple small step to move you forward in your journey to better health. Because Healthy looks great on you.
The information contained in this podcast is for educational purposes only and is not considered to be a substitute for medical advice. You should continue to follow up with your physician or healthcare provider and take medication as prescribed. Though the information in this podcast is evidence-based, new research may develop and recommendations may change.